Did you know that over 1 billion people worldwide are affected by parasitic worm infections? Yes, that's right. 1 in 7 of us. These infections are not just a distant problem, but a pervasive threat that impacts individuals across the globe, impairing health and hindering daily life. Parasitic worms, which include a variety of species such as tapeworms, roundworms, and hookworms, invade the human body, often thriving unnoticed for years. These organisms are responsible for causing a range of health issues, from anemia and malnutrition to severe neurological disorders. The burden of these diseases is particularly heavy in tropical and subtropical regions, but knows no real borders, affecting people in developed countries as well. These infections fall under the category of neglected tropical diseases, a group of illnesses that are often overshadowed by other global health priorities despite their vast impact. These diseases continue to persist due to factors like inadequate sanitation, close contact with livestock, and lack of access to clean water. This staggering number includes individuals from all walks of life, even prominent figures like Robert F. Kennedy Jr. Imagine discovering a parasitic worm living in your brain. That's exactly what happened to Robert F. Kennedy Jr. This startling revelation came to light when Kennedy shared his diagnosis of having a brain parasitic worm, specifically suspected to be a pork tapeworm. This condition not only highlights his personal health struggle, but also casts a spotlight on a larger, often overlooked global health issue. Kennedy's journey began with symptoms that could easily be mistaken for less severe health issues: headaches, slight confusion, and general discomfort. These are symptoms common enough to be dismissed as routine ailments. However, upon further medical investigation, it was revealed that the root cause was far more sinister: a parasitic infection in his brain, a medical condition known as neurocystis urcosis. This is typically caused by ingesting microscopic eggs of the pork tapeworm, often found in contaminated food. This diagnosis is not just a rare medical anomaly. It represents a widespread health concern affecting millions worldwide, particularly in regions where pork is commonly consumed and food safety standards may be less stringent. The tapeworm eggs can hatch within the human body, with larvae migrating to the brain and other tissues, causing a range of neurological impacts, from mild symptoms to severe seizures, and potentially life-threatening complications. Robert F. Kennedy Jr.'s case brings into sharp focus the critical need for awareness and understanding of parasitic infections. His status as a public figure helped elevate the conversation around a group of diseases known as neglected tropical diseases, which, despite their prevalence, receive relatively little attention on the global health stage. Kennedy's experience with this disease underscores the indiscriminate nature of parasitic infections. They can affect anyone, regardless of their lifestyle, cleanliness, or social status. It's a vivid illustration of the need for global cooperation in addressing health issues that have the potential to cross borders and affect populations indiscriminately. Kennedy's case is a stark reminder that parasitic infections know no borders or social status. But what exactly are these parasitic worms, and how do they invade the human body? Let's dive into the world of one of the most common culprits, the pork tapeworm, scientifically known as Taenia solium. This creature leads an incredibly complex life, cycling through different hosts and stages to survive and reproduce. The life cycle of the pork tapeworm begins when its eggs are ingested by pigs, typically through contaminated food or water. Inside the pig, these eggs hatch into larvae, which burrow through the intestinal wall and migrate to the muscles, where they encyst and wait. When humans consume undercooked or raw pork containing these cysts, the larvae are ingested and make their way to the human intestine. Once inside the human host, these larvae attach themselves to the intestinal walls using hook-like structures on their heads. Here, they mature into adult tapeworms. These adults can grow impressively long, sometimes reaching up to several meters. They survive by absorbing nutrients directly through their skin from the digested food in our intestines. As adults, these worms produce eggs that are released into the environment through human feces, continuing the cycle if they reach suitable conditions to infect another pig. This transmission route highlights the critical role of sanitation and food preparation practices in controlling the spread of tapeworms. Understanding the life cycle of parasitic worms like the pork tapeworm not only fascinates, but also alarms, reminding us of the intricate connections between human behavior, animal health, and environmental conditions. Prevention starts with understanding, and understanding begins with knowledge about these creatures' life cycles. The consequences of parasitic worm infections can be devastating. Imagine over 1 billion people around the globe grappling with these hidden invaders, often without even realizing it until serious health issues arise. One of the most severe outcomes of these infections is neurocystic urcosis, a condition where cysts form in the brain due to parasitic worms. This can lead to a range of neurological symptoms, from severe headaches and confusion to more alarming effects like seizures and cognitive decline. In many cases, the journey doesn't end with diagnosis. For some, neurocystis urcosis progresses to long-term neurological damage, which can be life-altering. The statistics are sobering. Each year, thousands succumb to complications related to parasitic infections, with many more left battling chronic symptoms that diminish their quality of life and ability to function daily. The impact extends beyond individual health. Economically, communities suffer as sick individuals cannot work, children miss school, and healthcare systems become strained. The cycle of poverty is often perpetuated, as those affected are unable to break free from the limitations imposed by their illness. Internationally, the burden of disease is unevenly distributed, predominantly affecting populations in tropical and subtropical regions, where sanitation challenges and close contact with livestock increase the risk of transmission. Yet this is a global issue, as travel and migration can lead to outbreaks even in developed countries. These health issues are severe, but often preventable with the right measures. How can we then protect ourselves and others from these invasive organisms? The key to combating parasitic worm infections lies in a dual approach: prevention and treatment. Firstly, let's delve into prevention, which is primarily about interrupting the transmission pathways. Good hygiene is the cornerstone of prevention. Regular hand washing, especially before eating and after using the restroom, can significantly reduce the risk of ingesting eggs or larvae that might be present on contaminated surfaces. Another critical preventive measure is food safety. Cooking meat to the appropriate temperatures ensures that any parasites present are killed. It's also essential to wash fruits and vegetables thoroughly, particularly if they are to be consumed raw. In regions where parasitic infections are prevalent, it's advisable to drink bottled or boiled water to avoid consuming waterborne cysts or larvae. Beyond personal hygiene and food safety, community-wide efforts such as improving sanitation and educating the public about these infections play a vital role. Preventative chemotherapy, a strategy endorsed by the World Health Organization, involves administering medication to at-risk populations to reduce the disease burden. This approach has been instrumental in controlling infections on a larger scale, especially in areas lacking resources for individual diagnosis and treatment. Turning to treatment, there are effective options available. Praziquantel and albendazole are the most commonly used drugs to combat these parasites. Praziquantel is particularly effective against schistosomiasis and other fluke infections, while albendazole is used to treat infections like neurocystis urcosis, which can arise from pork tapeworms, the very type that affected Robert Kennedy Jr. These medications work by targeting the adult worms, inhibiting their ability to absorb glucose, ultimately leading to their death. Treatment not only helps in alleviating the symptoms, but also in preventing the long-term health complications associated with these infections. In some severe cases, such as when parasites invade the central nervous system, more aggressive treatments, including surgery, may be necessary. In conclusion, while the challenge of parasitic worms is daunting, it is not insurmountable. Armed with the right practices and treatments, we can combat the spread of these infections effectively. The battle against parasitic infections is not just about treatment, but also about innovation and awareness. As we venture further into the realm of global health, the urgency for groundbreaking solutions becomes more apparent. The development of vaccines against parasitic worms is one of the most promising avenues of research in this field. Imagine a world where a simple vaccination could prevent the spread of these debilitating infections, much like how the polio vaccine has nearly eradicated that disease globally. Currently, researchers are tirelessly working to understand the complex life cycles of these parasites to identify potential targets for vaccination. This endeavor is not just a scientific challenge, but a beacon of hope for millions who live under the constant threat of infection. By preventing the diseases at their source, vaccines can provide a sustainable, long-term solution that could eventually lead to the eradication of parasitic worms. In addition to scientific innovation, there's a significant need for enhanced global health initiatives. Organizations around the world are stepping up to this challenge, focusing on increasing awareness and improving sanitation, which are critical components in preventing infections. These initiatives are vital in communities where parasitic worms are endemic, offering education and resources to protect those most vulnerable. Moreover, international cooperation is pivotal. By sharing research, resources, and strategies, countries can more effectively combat these neglected diseases. The global health community recognizes that the fight against parasitic infections is a shared responsibility, one that requires the collaboration of nations, researchers, and healthcare providers worldwide. With continued effort and global cooperation, we can look forward to a future where parasitic infections are no longer a neglected threat. The path forward is clear: innovate, educate, and collaborate. By focusing on these key areas, the dream of eliminating parasitic worm infections can become a reality, safeguarding the health of future generations across the globe.